different.
communicable
It's
diseases.
still something that we're spreading from person to person, much like COVID spreads person to person. Okay, keep going.
So it is an communicable disease that affects the spinal cord and can cause paralysis to the human.
Yes, yes. And think about this. Polio was really bad because when we talk about paralysis and lifetime implications, that affects what we, two words we're going to talk about today. Well, one we talked about last class, which is disability adjusted life years, which were those dailies. The other thing it's going to talk about is the global burden of disease. If you're impaired and you're paralyzed, you have less likelihood of being able to what? Do work and contribute. So you're more of a burden on society than you are contributing to society in your adult years.
Yes.
Excellent. Excellent. Okay, now let me ask this.
Doctor,
Yeah.
doctor,
Yes.
about the percentage of Jordan and USA.
Yes. Scary.
Yes, Doctor, this percentage for Jordan is frightening and dangerous because Jordan population is 7 million,
Well,
and this percentage is large for this number.
yeah.
Yes, the ratio must be less than half.
Well, that's the death rate. And we'll talk about those as well. I wanted to do that, and I didn't know how it would end up. I just, over the weekend, when I saw the numbers keep going up and the U.S. numbers are going up, I thought, let me try to get this perspective, because today's lecture is all about demographics, which is being able to compare different countries, different populations, different aspects about people. So I thought, how perfect, let's compare the U.S. to Jordan and see where it really is today. And what I did, and let me just open my little notes because I wrote down a little short cheat sheet so I could tell you how I got there. It's very easy. What I did was the U.S. population is about 330 million people, okay? And currently the Jordan population comes in at about 11 million people. Now, we've all, maybe you don't watch U.S. news like I do, and I'm sure you probably don't. You would not have that same interest. But in the U.S., the last couple of days have been the highest rates ever. And we have about 80,000 new COVID cases across the country on a given day, out of a population of 330 million. If you take the 80,000 and divide it by the 330, you get 0.0000 something, and it finally comes to 242, and it goes on. When we compare rates, we can compare them by per 1,000 people, or we might compare them by 10,000, or we might compare them by 100,000. I did it by 10,000. That came out to 2.42. Now, the scary thing is Jordan right now has a population of 11 million. And I took a daily average of about 2,600 cases. Okay, that was, and it's just an estimate because a couple of days it's been slightly lower, a couple of days it's been slightly higher. So again, I was just giving an average, and that came out to 0.000236, da 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 da. And when I multiply that by 10,000, it's 2.36 per 10,000. So if we're looking at that, it lets us understand that we're seeing the same thing. The number of cases per population, per people, is almost identical. And you all know how I feel about the U.S. policy. Not very good. Did this, a couple of you, and I saw the facial reactions. I saw some surprised faces, which is exactly what I expected. I saw some sad faces. I saw some thumbs ups. Were they thumbs up just because I was giving you the rate? For those of you that did the thumb up on the reaction, maybe one of you wants to say, Mohammed, I see your hand is raised and you've been very quiet. You're welcome. If it's raised to answer, you're welcome to address this as well. What was the thumb up for? A couple of you that put thumbs up, was it just a thumb up because, oh, thanks, we're glad to know that? Mhm. I know I started early. I'm talking about what I posted on about the numbers. Like I said, let me go ahead and say this again. I will start recording early, and that's only to make sure that everything is working. Um, I was taking a few minutes while people were here to ask them what they thought about the numbers, what they found out, things from last time. And so we were really just starting to discuss really kind of the beginning of where class starts.
Doctor,
Yes.
the two reports included in exams or not? It's just information.
You know, you all keep asking me memorization and information. I give all this to you in hopes that you will read it because it helps you do better. So I really kind of want to, I know you all learn differently in high school and you learn differently in some of the other classes here. Anatomy and physiology is core memorization. But this class, and I keep saying it's not about memorizing, but it is about reading. And there are terms I do expect you to know, like demographics today. I'm not going to come. And so it only helps you because what we are seeing right now is really health policy in action. And it's one of the few times I really have the luxury of teaching this class where we actually are going through something that is so important that everybody understands its implications. Health policies are going on all the time about other topics, but most people go, but this seems to affect, and it affects everybody in the world right now. So they really are designed, the more you read what I throw out there, I'm throwing it out there because honestly, I've made a new PowerPoint for later this week that we'll talk about later. Mohammed, your hand is raised. Your mic is up. Can I help? No. Okay.
Good morning, teacher.
Good morning.
Please slowly explain to can you catch you? You explain very fast.
I know. Native speaker. Sometimes it's like me trying to hear Arabic and going, shwaya, shwaya.
شوية شوية.
Okay.
Dr. Harvey, I
Thank
have a
you,
question.
doctor.
Okay, so this morning, does somebody else want to share their opinion right now about those numbers?
Yes, doctor,
Is
I
that
have a question actually.
a question before I've started class, okay?
After seeing these numbers, I thought like at first Jordan was among the best country of dealing with this pandemic. So what happened to Jordan, or what's wrong with decisions that make Jordan like this, making these mistakes and this increase in number, and what's the wrong policy that they took?
Well, I don't know that it's the wrong policy. That's a great question, and it's a great way. Thank you. That's a great way to start the class.
I answered. No.
You can try. Let's see what your opinion is, okay?
So I want to ask what makes Jordanian people doesn't follow the instruction by the way other countries are following or dealing great with this.
Because when Jordan do some policies, social distance, social state between people انعدمت مثل ما بيقولوا، ما عاد في social بين الناس، فالواحد بصير يحس باللونلس.
I know, man, but
The standard of
countries
living.
do that policy, and only Jordan, which country that doesn't follow these instructions? So why like these things happen just for Jordan?
Well, and let me try to address that. I don't think it's just Jordan, okay? And that's been what your numbers show is when we equate that to US numbers, and what we could do is, again, I could go into France today and probably get close to a similar kind of number. I could go into a couple of other places. I could go into Spain, I know, and get a similar number because they have gone on an emergency lockdown again as of today. Just in Israel, a couple of weeks ago, they went back into a full lockdown because their numbers were like this. So it's not just Jordan. Part of it is human nature. When we talk about health behaviors, and wearing a mask is technically a health behavior, hand washing, while we're talking about something called primary prevention, and we need to definitely learn as we go forward the difference between primary, secondary, and tertiary prevention.
Yes, yes.
Okay, hands down, guys. Okay, because I'm going to do lecture, and then I'll come back to hands a little bit. I'll give a break and do hands again. What we do find is that, like most of us, modifying our behavior, even when we want to do something, is hard. Let me give you an example. People that want to stop smoking, and I say want, not are told, but want to stop smoking. It is an addictive process. Let's take the addiction out of it because we can physically end the addiction within about 7 to 10 days.
Yeah.
But everything else that you learn around that behavior has been reinforced every time. So all of it becomes difficult. And I've got to be honest, wearing a mask, while I've got really pretty masks that a friend of mine who is a doctor in Canada made they're colorful and they actually, trying to make the best of my mask situation.
Yeah.
It's not comfortable when you get, especially in the heat, you feel your own breath.
Yeah, your sweat, like, your breath, and
Yeah, and if you notice, probably most of you all as well, when you wear them all the time, you see little spots where your skin is rough. I mean, those are little things. But just when you talk, sometimes people can't understand you as clearly. All of those things, and it just is not natural to us. It doesn't
Exactly.
reinforce the behavior. So and unfortunately, what happened is Jordan was so good at the beginning with, as we called it from the WHO component, the coordinate and crush.
Yeah.
People, we did have this little bubble atmosphere. We thought we were safe. We thought we could get by without having to do these things. And instead, what we should have done is kept doing those things, and it would have stayed that way.
Mhm.
But we went back into our natural old behaviors, and it kind of comes, so it's not that, and Jordan is not, like I said, it's not the only country. It's not the only set of people. We're all humans, and we want to go back to what is comfortable for us, what we're used to. Well, unfortunately, this may be what we have to be used to at least for another year. So the sooner we get around that idea and you go, oh, this is just what it is.
Yeah.
Even because, hold on. Even if we create a vaccine, even if in the best scenario we get a vaccine that starts being ready and sent out for healthcare workers and others the first of the year, the end of this year, first of next year. By the time we're talking about enough people vaccinated and it's starting to take hold, we're looking at this time next year globally. That's in the best scenario. So let's we need to stop. And this is what I hate about Donald Trump, is he keeps saying, we're almost there, we're almost there. Well, we're not almost there. In the span of lifespans, we're almost there. But we've got a year, and we really need to think, let's do all of this, plan on this for the next year. If we plan on it for the next year, then as things get better, we taper back. But instead, a lot of people think, oh, it's going to be sooner. And the realization of there really is a bit of time still. So this comes into that. Now, guys, I know there are other questions, and I see hands raised. But please, I'm going to ask you to let me go ahead and introduce a little bit of the demographics that we need to talk about. Then I'll stop, and I'll give some chance for some other comments, okay? Now, like I said, this morning, where we're starting is, and the reason why I put the numbers up is we're talking about a concept called demographics. Demographics, I'm sure you all know this, and I don't know what the Arabic word for it is, but we're just talking about using basic statistics. And when we talk about health statistics, we use the word epidemiology. And we're talking about, does it affect children? Does it affect adults? So we can look at things, and you see from this diagram on the front slide, age, profession, income. Does the disease affect more males or females? Well, even with COVID, we know there are poorer outcomes for men than there are for women. Marital status. Are some people more at risk if they're married or if they're single? Can you believe that some diseases actually do have implications on that? And when we talk about mental health, marital status is really important. The stage of the life cycle, where you live. So again, geography, US versus Jordan, this part of the world versus another part of the world, the Middle East versus Southeast Asia. Lifestyles. Do you have what we consider a Western lifestyle, which is a high-fat diet, sedentary, very physically inactive, things along those lines? So we look at all, and we can compare using these different variables. So again, this is just the definition of what I've said. Okay, again, here, down here, age, gender. I can compare you based on, are first-year medical students more stressed than sixth-year medical students? Okay, I could compare, do Hashemite University students have a different reality than just students? Okay, so that's that thing of level of education. We could look at religion. Is religion important? Okay, guys, a couple of you have still mics on. Social class. Well, we definitely.
هيني ها النص حطيت هدول بقى كتير ما انا بس
ياسين
إيه.
ياسينة
مش منطق كل شيء
I took care of that. Okay. Now, what we're looking at. So we're looking at social class. And we've already found what? COVID. Here's a great example. COVID right now, we know it has a harder impact on those that have less resources, that are poorer, because they don't have the access to the health care. They don't have access to medical treatment. We've talked about Jordan and testing. So we know socioeconomic income can affect things. Did you know that women, white, Eurocentric women, have a higher risk of a certain type of breast cancer? Did you know that there's certain demographic groups? I can give you an example that was very fascinating to me. You all in high school learn about a disease called gout.
Doctor, can I ask a question? No, I want to tell you that some people want to enter to the meeting, but the teams tell them that is full. They can't come.
I don't know what to tell you because...
Okay, if some people want to enter to the meeting.
I understand that, but I don't know. I'm not blocking them from entering the meeting. It must be something with Microsoft.
What they want to do?
I don't know. I guess this is something we're going to need to tell IT, because I'm showing 358 attendees. There's not a reason that they're not being allowed in. Unless, this is something that maybe Microsoft is putting a limit. The university has only done the free software. So I don't control the IT from that sense of who can. So maybe Microsoft is limiting it, but there is not a reason that they should not be able to just join the class. Unless it is not. Okay, guys, I appreciate what. Yes.
Do you like online lectures?
I love the part that I can show you more effectively. There are things about it that I really enjoy. I can actually have more conversation with you here than I do in a large auditorium where there are 300 of you and you all just sit. The other thing is I start to get names that I don't get from when you all are sitting in a large auditorium and there are 350 of you, and all I ever learn is usually the first row. When we talk about IT services, I can show you videos that I can't show you in class because they're not the system is not hooked up to allow me to do those things. So there are things here that I can do that are much more effective, actually for you all when we're talking about this kind of didactic lecture, it's much more effective. But let me get back to class. And like I said, I don't know what to tell others. I can, let's see.
Doctor,
Yes, Omar.
you said Europe white women have more risk to breast cancer?
Yes.
The Europe, yeah? White women.
And those are just, and there are different things. We start to realize that people in my organization, yeah, it's clearly set that students can enter the classroom. I just checked to make sure. So I don't know what else to help on that end. Now, hold on. That is a demographic piece, okay? Like I said, I'm not going to go in, and it's a great question. Some of it has to do with lifestyle. Some of it has to do with genetic composition. There are several reasons why we end up with women from a very high income. Having white women from a high income are more likely to have certain types of breast cancer. And it's a very specific strain when we get into the genetic coding of it. The same way, I don't know, when we look at SES, the diet, how diet affects certain risks for diseases, all of a sudden it's income related. It's not related maybe to their race or something else. It's related to the diet they can afford. So income impacts on that health outcome. So it's just an important, I really, right now, I'll do it. If you want to discuss breast cancer separately, we can do that later. But right now, I just want to use the example, okay? Residents, where you live. Are you more at risk at something if you live in the city or the country? Well, remember, if we go back and we talk about the COVID right now, you will find that what? What did we see? We saw that with COVID, the population we were more at risk if you lived in a big city, whether it was Paris or London or New York. The big cities had a higher spread. So we look at things like this, and these are all examples of different demographic variables we might use. Okay?
Doctor, you wanted to give an exam about something in the high school before the students interrupt you.
Excuse me?
Yeah, the disease.
Sample, not exam.
wanted to speak about activities in high
كيف
school.
تطبلنا امتحان انت اذا
Guys, I'm really hoping I can, I appreciate the questions, but what is the, you've got to let me, I'm happy to answer questions, but you kind of just stop the flow. Whew. Okay, is there a question about what demographic means?
No, just you said you want to give an exam, but you forget it.
Example.
Example, yes.
Examples.
What?
Yes.
Guys, I'm going to mute everybody if this requires a full conversation.
Yes, please.
Yes, please. Okay, I'm putting you back on mute. We'll come back in and I'll take the mute off. Okay.
Wait.
Now,
Doctor?
what I'm going to go ahead and say is, so demographics, And this is just, like I said, this is again a slide that's just defining demographics. So we can group you by region. Like we might group somebody by being Middle Eastern, we might group somebody by being Western, we might group them by Middle Eastern females, we might group them by young adults from Europe or different things. So we do this to see different components, and we're going to look at, are we seeing birth rates go up? Are we seeing death rates go up? Are we seeing certain trends? So we just use these for specific populations. You all already know what the definition of a population is. I can talk about a population of Jordan, which is all the people that live in Jordan right now. I could talk about the population of Hashemite University, which is all students that attend Hashemite. A community is just a smaller group within a population. Okay, and we can talk about it from a biological perspective, where we talk about a niche, and that's all the living organisms that are interacted in a certain populated environment. Or we can talk about it like the people that go to your local mosque, up here where it talks about a small social unit. That could be a community. The people in your local mosque, your local church, the people that attend a specific school. Those could be examples of smaller communities, the same way we have community health centers that focus on a specific population. Now, this is something you do need to know. Now, I'm not going to ask you which generation is what years. What I want you to know is that often when we look at demographics, we talk about how it affects different people from different age groups. So we have different generations. And I have to be honest, you all are not millennials. You all are Gen Z. Okay? I come, and this will date me, I am right at the end, so you all can go do the math, of the boomer generation. Okay? Generation X. And it's saying that this is your population. It's describing when you were born. Okay, so you're born and you're kind of clustered as a group because your experiences in life are very similar. You all as Gen Z are truly the first generation that has grown up with a totally digital platform and a different way of digital learning. It makes you very different. I grew up as a boomer, and the boomers were called that because after World War II, lots of parents had lots of babies. So there was this huge population growth. Okay, and those were the boomers. Boomers, my generation, we have children that are millennials or Gen Z. Okay, so you're typically our children. And it's just a way of defining populations. And are there differences? How you learn in school is differently than how I learned. Okay? How you do certain things are very different. So we look at this. Well, and so I say, know these, because a lot of times I'll make a reference to, oh, this is different for baby boomers, or this is different for millennials. And millennials were the ones that were the crossovers. And millennials are now young adults, and they're the people that kind of need to take responsibility. We talk about them being coddled and different things. But we look at them as a group because their health issues will be similar because they're of a similar age. They had similar environmental exposures. So we often compare people by generations. Look at it as another type of community. Now, that being said, the next is just explaining what is epidemiology. Demographics, so like I said, we are going to use, and you're going to start using these things. And that's what's important today, is we're going to start using different demographic variables to explain the risk of different health problems. And you're going, oh God, this sounds horrible. It's math. It is math, but it's the easiest of math. If you can do fractions and you can multiply and divide, that's as hard as the math is going to get. Okay? What we do is epidemiology is just the term. It's the term we use when people go, oh, are you studying epi? In U.S. medical schools, we actually have a course in epidemiology. I think actually, I know Just does do a course in epidemiology. What happens at Hashemite is you get a little epi from me, you get a little epi from Dr. Aman in a couple of courses, you get a little bit more epi when you get into research. So we've kind of given it in little sections of it in different classes. But all it means, and you can see from the definition down here, it says epi is upon, demos is people, so the study upon people. So we're using health statistics to figure out what happens to people, okay? That's all the word means. Big word for a very simple concept. Now, as we go forward, this is more important. So what do we do with epidemiology? And you're going to see I'm going to blow these up so I can scroll across. We use epidemiology and we use these statistics to identify the cause of a disease or who's at risk. The word etiology just means the origin or the cause, okay? I've said etiology or the cause. That's the definition of etiology, okay? What causes someone to be at risk? Well, let me ask, and I would say this, what would cause somebody, in your head, think, what would cause somebody to be at risk for COVID? Not wearing a mask, being around people a whole lot of times without social distancing, without proper hand washing, because there's no sign that says, COVID, I'm COVID positive or I'm COVID negative, but taking those behaviors increases one risk. If you remember from last week, we saw some slides that talked about the two biggest risk behaviors. One is what? Spending time with family member who have been in contact with somebody that's had COVID. The other was you've eaten out at a restaurant in the last couple of weeks. Those were risk behaviors. So those are the possible risk. Then determine the extent of the disease found in the community. Well, that's exactly what I did with those numbers that I posted yesterday. How many people, for every 10,000, how many people are getting COVID? Okay? So what's the extent? Is it common? Is it rare? Is it something that we need to be concerned about? Well, it could be common, but if it's not communicable, we have a different way of dealing with it than if it's a communicable disease. Okay? We can talk about studying the prognosis, to study the history of the natural prognosis of the disease. Just like we as human beings have a life cycle from birth to childhood to middle-aged adult to death to old adult to death, a disease has a cycle or a pattern. Some diseases work based on different types of season. Some will come and go. So what's interesting is right now, we don't know the history and the prognosis of COVID. That's what makes it so hard. It's a new disease, so we're figuring this out as we go along. We don't have something to rely on from before. We look at other patterns of other types of coronaviruses to try to figure it out, but we don't have a history here. Okay? So this is part of epidemiology. When we look at the last couple of criteria, the next is to evaluate both existing and preventative and therapeutic measures and modes of healthcare delivery. So let's talk about this. We're talking often about, can we develop a new vaccine? Do we have a treatment? Well, here's the problem right now with COVID. We don't have a proven vaccine yet. We don't have any proven effective treatments. We don't have a cure. We have medications that are about 3 or 4 that we now think work on treating the signs and symptoms, but they do not make you better. They treat the signs and symptoms to make you feel better, but they're not changing what's happening with the COVID disease. Okay? So here we can talk about, again, what's the new preventative? So what are we talking about? almost all of you in the surveys from last week said, what's the most important thing we can do? Wear a mask, wash your hands, socially distance. I am so thrilled to hear you say that. Now you need to say that to everybody you know all the time. They may think you sound crazy. They may think you sound like a broken record, but that's how we prevent it. And right now, the only thing we have is prevention. We can stop it by preventing it right now, because once you get it, we can't stop it. So epidemiology looks at those things and what will happen. I think last week, if I stand correct, they put out a paper in the United States. Gizmo, who are you barking at? Hey, you. I see the tail. Who are you barking at outside? Izzy, come here. Say hello to the class. You want to say hello? I will introduce you all.
كرامتنا صارت بالأرض كلب.
Yella, come over. This is Gizmo. Gizmo helps me teach class often.
يحكوا هاي
So
يحكوا هاي
if
يا
you
أخوان.
ever hear the word
هاي
نور نور هاي
الكرامة بالأرض يا أخوان. خلنا هوا. السلام.
إذا عشت من هذا الزمان.
So this is
هذا
the
مش
bar.
كلب
منور.
Now, so, okay, sorry about the disruption. Gizmo likes to be known.
نورك.
So, here we go. We look at the prevention. That's the last thing I'll say about prevention. And then the last thing is, okay, to provide a foundation for developing, guess what we're talking about? Public policies, our regulatory decisions for different problems. So here we get into epidemiology based on the statistics, based on what we see, we start to try to figure out policies that will work for class. So that's really where we go with that. So we use these statistics to develop policy. Now,
مايك
خالد
Mike,
جانب.
خالد ناجح.
خالد المايك.
thank you. Now, the next thing, and probably where I need to, is we use this and we figure out the distribution of disease. So who gets sick, their age, their occupation, their race. Do we get sick more in the winter or the spring? What's really interesting is if we talk about a different coronavirus, which is the flu, influenza, we have trends. In some parts of the world, you get the flu more in the winter. In some parts of the world, you get the flu more in the summer. We look at neighborhoods. Is there an outbreak in a certain region? Do you remember at the beginning of COVID here in Jordan when they were doing better at the coordinate and crush component? They really had this ability, and they would identify, we've closed down this little area. We've closed down this little community. We've boarded this up. When we can localize and have a cluster, we can stop that cluster there from what? Getting bigger and bigger and bigger. So we look at these distributions and patterns. Does it affect us based on where we live? There's some diseases I can't get in Jordan because it's a dry desert, versus there are other diseases that are related to mosquitoes that only live in certain regions. And there are other diseases that are related to ticks, ticks for Lyme disease, things like that. So we can talk about different places. Are you affected? Are you in a region where you could get that disease? Okay, so we look at latitude and that being latitude or climate, urban versus rural, national variations. So it's all these patterns. And from these patterns, we try to determine what we call GBD, which is the global burden of disease. Okay? What we're talking about, and guys, you don't need to be able to read the graphics on the left, but it's just giving examples. Things that cause global burden of disease. If I look over here, you can see a hamburger. We can see roadways. We can see blood pressure. We can see vaccines. Okay? All of these can help reduce or increase the risk of disease. What we're going to find out is that road injuries are the number. Road injuries, traffic accidents are the number 4 cause of death in Jordan. Okay? You have higher than the world statistics for dying in a traffic injury. So we look at different things. So the definition is a comprehensive regional and global assessment of mortality and disability from diseases, from injuries, and other risk factors. And we try to explain, what does that do to our society? When we talk about global burden of disease, in other words, while I may choose to eat all those, remember, I've given the example a few times. You can eat all those hamburgers you want, and you're only putting yourself at risk. But here's the thing. Is it fair if we have a universal health coverage that I'm going to pay the bill for when you have a heart attack? Is it fair that I'm going to pay the bill when you have hypertension because you smoked for 30 years? These
It's
are
not fair,
questions.
doctor.
Oh, yeah.
Because like it's your health, why do I have to pay for it?
Well, if we have universal health care, which means what happens is the money I make, I'm paying taxes for my health insurance. Everybody's paying taxes. But my taxes are paying for your treatment, not my treatment. And that's where so we kind of get into an ethical quandary of, is it fair? We know that in the United States, people that smoke, they pay more for their health insurance than people that don't. We set that priority. There are ethical considerations. I believe in
Doctor?
universal health care. Yes.
Eventually, everybody's gonna use their health insurance. Like, I mean, like, we're all paying, but we're all gonna get sick at the end. So we're not just like paying for someone else, like medication. We're paying for ours also. We'll eventually get sick also.
But is it exactly? We will all get sick at some point, and that's why I think it's okay to say at one level. But if you start, we then start equating, are you taking more risk? You follow? And
Yes.
if there's a certain group of population that takes a lot more risk, that costs a lot more money, how does that relate to people that don't take those risks? And there's not a right or wrong answer. This gets in kind of to the ethics again of why we believe in universal. Some people believe healthcare is a right, and everybody has the right to healthcare. That is my philosophy. Okay, it may not be yours, but it is mine. But also, do we have a responsibility to others among ourselves to make sure that we're not being a burden on society? So global burden, like I said, global burden of disease really looks at what are the costs that is an impact. In other words, I'm going to show you a graphic in just a minute that will try to show you the difference between income and healthy communities. And it's a global perspective. I think this will kind of address a little bit of our issue that I'm trying to address here. Okay? I'm hoping it is this slide. This slide is hard to see. I'm going to blow it up a little bit. It's one of the first bubble graphs that came out from the CDC years ago, about 4 years ago. Okay? 5 now. If you look at it, let me show you first of all. Look over here where I'm running my arrow around. You see color by region. So any green dots are coming from North and South America. Yellow dots are predominantly Europe, Russia, European areas. The red dots include the part of like the Gulf, Asia, and Southeast Asia and Australia. And the blue dots are Africa. So it would include the northern African regions. So the color is where they are geographically in the world. Now, if we look on the vertical line, we're looking at health status. And this is done in life expectancy, which is the number of years you're expected to live. I will encourage you, and I'm sorry, Jordan, I cannot find Jordan on this bubble graph. I've tried for 1.5 years, okay? But I can find Egypt, okay? I can find, if I look over here, Saudi Arabia. What's really interesting is oh, hold on, and I've got one other thing. So this is our healthy versus sick going up and down. The other thing is if we come on the horizontal axis, we're looking at income. Poor countries, less money. The most wealthy countries will be down here at this end. So notice when I come over here, Qatar is the wealthiest country in the world, okay? We've got the UAE over here. We've got a lot of the Gulf pieces. We've got Singapore, interestingly enough, Luxembourg, Saudi Arabia, and the United States is the big green dot. Saudi is the red dot. But what I want you to look at, and this tries to explain global burden of disease, it's not about the money you have. Because if I look at really who's healthiest, it's most of these yellow countries, except for Japan and South Korea, both being very wealthy, predominantly Asian countries that have good health infrastructure. What we know about these countries is that these are countries that provide universal health care. Europe has, almost all the countries in Europe have universal health care. They're not the richest, but they are the healthiest. The United States, we kind of fall down. We're not as healthy, and we are richer. Saudi Arabia has adopted very much American lifestyles. Okay, they are very sedentary. They have obesity problems. They have cholesterol problems. They have heart disease problems. They are moving on the path, and it shows right here. Okay, Oman, not as wealthy. Okay, and just a little bit of difference in health status. Okay, so we can look at this. Turkey has excellent, when we look at this, not nearly as wealthy, but pretty darn healthy. Okay, so I love this. And we get down here, and what does it start to show? We start to see all our blues, which is, guess what? Some of our poorer countries are also our countries that have the least health infrastructure, so they have more health issues.
So doctor, you tell us that income not or rich not associated with healthy. Yeah.
Well, it is, but what we can, it shows that income is related at a certain point when you don't have the government infrastructure. And where we have countries that have universal health care, in other words, they don't have to worry about if they get sick, if they can afford to go to the doctor. It's already covered. They go to the doctor regularly. They get their medications. They don't have to be, that is part of their country's services to those citizens. They are typically the healthiest.
Doctor, what about Jordan?
Jordan, we don't have universal health care. And like I said, I don't know why Jordan is not on this map, because almost every country is, except for I can figure that Jordan did not provide data that let them map.
It is on the edge of China.
Egypt is down here, okay? You are somewhere probably in this range.
Doctor, I had just to check the website and it said like 79.6.
Guys, you can't all talk at once. That it really does make it hard. One at a time, okay?
Doctor, I just checked the website.
Yes.
And it said that Jordan is about 79.6 of life expectancy.
Actually, we're going to go through life expectancy in just a minute, Abdullah.
No,
okay?
I mean in this.
No,
Doctor,
that's
it's between Peru and Colombia.
that would be, if your life expectancy, like I said, you should be around here.
Yeah.
You're not, but you're not graphed, and I don't know why. Like I said, and you can look, you can see Iran's in here. Gizmo. Thank you.
Doctor,
Yes.
can we say that the country that is rich, the health in it is better? Health
Well,
care is better?
and that's what this, you can say two things. One is that income does affect health, but at a certain point, those with the best health have universal health care. So in other words, when it's up to a certain point, that money is important because it does provide access. But if we have universal health care, they are the healthiest because they all have access. So that whole country, it's not just the rich and the poor. So it moves everybody up to being healthier. So you can say those two things work together. And that's what this graph I love this graph because it really does show those differences. It shows that income up to a certain point has an effect. But again, like I said, it shows that having lots of money does not make you the healthiest. Okay? Look, Qatar, UAE, and I can't read what that one is, honestly. Here's Kuwait. Okay.
Doctor, I think Jordan is above China. It's below Peru.
Yes,
Yeah,
right.
beneath Peru.
between 75
Between
and
Peru
Yes, I found it.
Yes. Yay!
Yes, I found
Congratulations.
it.
I've looked and
It's a bit
looked and I
small.
was always blind. This little
But you
tiny.
see in the previous lecture, this 72 just.
Yeah. Okay. So when you look at this, again, Jordan doesn't have as much money, but they're doing better on the health. They were doing better on the health spectrum than some other countries. Look at the comparison of Jordan versus Egypt. Okay. Now we can do some fun. If we look here, Jordan has better health, but the income is not hugely different. Yeah, you're a little bit ahead, but not much. Okay. Let's look at you compared to healthcare in Russia or Czechoslovakia or whatever that is down here below it. Okay. Uzbekistan or something. I don't know what it says. But we can look at this and look, you're better up here. So this is just a fun graph of showing you up to a point we have certain things that work and certain things that don't. Now, I can tell you that Jordan sits up here very healthy because you are a very young country in the sense of not how long the country has existed, but your demographic population. Again, that gets into the mean age in Jordan is around 32 years, okay? Now, I know we're at
Doctor?
9. Hold on. I need to do a couple things because I've got to finish class, okay? And I know you have another class with Dr. Iman. So give me just 1 second. Let me minus this out. And this is what we talk about with life expectancy, okay? Life expectancy, and it's just a definition. It's based on the year you're born, how long you should live. The year I was born, the life expectancy for a woman was about 82 years of age, okay? So that is, if I do everything right and normal, on average, I should live to be 82. Now, there'd be some people, I may die before 82. I may live after 82, depending on different things and what's happened. And these are some based on my culture, my education, lifestyle factors, how I behave, all of those things. But the average life expectancy. So what I want you to see is down here, in the world, Japan has the highest life expectancy of anywhere in the world. Okay? This is from the Health Olympics, and I've got to say this was taken this year. Okay? So 2018, which is about as current as we get with data. Okay? Take some time between now and next week and look at these. What you're going to find is there's only really one Middle Eastern country I'm going to exclude Israel. While it's up here, it has a very different demographic. But when we look, is Qatar, okay? And that's really the one I want you to see. The United States, like I said, when I was born, life expectancy was 70, for me was 82. So what's happened is the U.S. is one of the few countries in the world where we have gone backwards, which means what? We're not doing good things for our health, okay? The life expectancy, if they were born in 2018, now is 4 years less than what mine is. Where we will start next time is we're going to talk about the U.S., and these were 2016 data. Now, as I finish up, I want to mention to all of you, okay, I have a new PowerPoint. I have put it in your folder. It is called Hey, HP Changes 3B. I'm going to see if it will share with the screen really quick before we leave. If not, it is in your folder. It said, and the number is 3B, as in boy. Okay?
Doctor?
Yeah.
You can download the lesson in file Teams.
You can download what?
The lesson.
The lesson.
Always. I don't know if you can download it yet.
The lecture.
She means to upload it.
Now, what you should see is this is the PowerPoint that I'm wanting you to look for. On class on Wednesday, we are going to combine demographics with the articles that I collected this weekend. Guys, this is from this weekend. Already, my data will be out of date. Now you can see why in the beginning when you all kept asking, do I memorize these numbers? Do I memorize? No, because they're going to change every day. And literally, this is dated the 23rd. Today, we're already different. But I want you to take some time. I have taken different clippings, some of them from the articles I posted, some from other things. And you will see that I've just posted things about what's happening in Jordan, reevaluating risk, and I want you to kind of go through these because we're going to, I want you to identify the different demographics, things along those lines that are in here. We're going to look at the different numbers that are changing when we look at demographics with COVID, okay? So one set of slides, as we finish 3, is just on demographics and understanding. The other is applying it to COVID, okay?
وين بلاقي سلايداتها؟
Doctor, can I ask
class material?
question? Are you going to be taking attendance for this lecture because students could not join? Are you going to be taking attendance?
I am taking attendance. It's an automatic roll.
Because some students are messaging me telling you because they couldn't join because of the.
I don't know. I have no control, and I appreciate you all letting me know that. What they need to do is report that to Dr. Tamimi or Dr. Tarek, because I have no control over the IT. I will send a message to them saying students were saying they could not join, so they can make a report of it.
Oh.
I don't own the software. It's Microsoft. There's no reason. From my end, there's not a reason why they shouldn't be able to join. So we need to report it so IT realizes they are having a problem from their IT side. Does that make sense?
Yeah, it makes sense.
We have to read the PowerPoint only read.
Guys, the questions about memorization and reading are not questions I can answer. I've answered it as well as I can. You need to.
Doctor, I have a question.
Okay. Guys, you've got
question
class.
about the bubble graph.
She means what?
Doctor, we have a class now.
I know. That's what I keep saying. I'm through. I keep telling you. I'm
Can we
finished. I know you have class, but some of you keep wanting to talk.
Give